fatal disease that is caused by parasites that are transmitted from infected female Anopheles mosquitoes to humans through bites. Although there are 5 parasite species that cause malaria in humans, however, 2 of them pose the highest risk. Those are Plasmodium falciparum and Plasmodium vivax. Malaria is treatable, but if it is left untreated, infected persons can develop severe complications and die. Malaria is common in countries that are tropical or subtropical. Symptoms of malaria can begin within a few weeks of being bitten by an infected mosquito. Although there are some types of malaria that can lie dormant in the body for up to a year.
Malaria signs and symptoms appear at first as flu symptoms. These include fever, sweating, chills that shake your whole body, headaches and muscle aches, and fatigue. Later on, a person may experience symptoms like a cough, chest pain, breathing problems, diarrhea, nausea, and vomiting. If these symptoms are left untreated, malaria can become worse and the person may experience anemia and jaundice.
Malaria can be controlled if it is treated at an early stage before it becomes a severe condition. Receiving prompt treatment usually results in full recovery of the disease. Malaria is treated with anti-malarial agents. The most common is chloroquine. Malaria patients are treated based on the intensity of the disease and whether they are affected by a species of Plasmodium. If a patient has non-falciparum malaria, they are not admitted to the hospital. They are treated in the outpatient department and is given chloroquine. Patients diagnosed with falciparum malaria are admitted into the hospital and is situated in the HDU, highly dependent unit, or the ICU, intensive care unit. These patients' medications may be delivered intravenously or orally. Quinine is the drug used mostly for these patients. Some Plasmodium parasites have developed resistance to very common anti-malarial drugs, so the type of medication chosen should be carefully thought out and closely monitored. For pregnant mothers with malaria, they cannot take doxycycline and primaquine because it may harm the unborn child. Mefloquine is the anti-malarial recommended for pregnant women.
There are many simple ways to prevent malaria. This includes our regular practice of using insect repellents, off lotions that are usually available in every store, maintaining the cleanliness of the environment, and making sure that your vaccines for malaria are up to date.
Malaria has affected many parts of the world, but it is mostly dominant in Africa. According to the latest World Malaria Report, there were 241 million cases of malaria in 2020, compared to 227 million cases in 2019. The estimated number of malaria deaths stood at 627,000 in 2020, an increase of 69,000 deaths over the previous year. While about 2/3 of these deaths were due to the disruption during the COVID-19 pandemic, the remaining 1/3 of deaths reflect a recent change in WHO's methodology for calculating malaria mortality.
We are all aware that the total eradication of these diseases is not complete. Therefore, we need to act as one and together overcome this pandemic.